Welcome to Reboot with Dr. Arasi Maran. I'm your host, Dr. Arasi Maran. I'm a board certified interventional cardiologist and I've been in practice for more than 10 years. And today we are talking about a topic that is close to my heart, literally. It's September 29th week, and it's the September 29th is the Heart Health Day, and we are diving into coronary artery disease and specifically on how to recognize the signs of a heart blockage. That is what coronary artery disease. Whether you are 40 years or above, or even in your 30s, this episode is all about reclaiming your life and prioritizing your heart health at any age. Let's start off with understanding coronary artery disease. Before we jump into the signs of a heart blockage, let's cover the basics, okay, as to what heart health is. So, as I have said before, the heart is a very powerful engine. And like any engine, there's a pump and there are fuel lines to the pump, which are the blood vessels. So, when these fuel lines are blocked or clogged or narrowed, then there's very less fuel getting into your pump, and the pump starts to fail or flutter or have chest pain, etc. And these can come in different formats. So, coronary artery disease is basically a blockage in the blood supply to your heart. And your heart provides blood supply to the rest of your body. So, if the main pump gets blocked up, the rest of your body is going to suffer. I usually bring different guests, but this is a topic which is very close to my heart, and I deal with blockages in the blood vessels of the heart on a day to day basis. So I'm going to be your host and your guest today. So let's start with the risk factors about the heart. Okay. So think of life as a card game, and there are cards you are dealt with, that is, you're born with, and then there's how you play the game. And that's how heart health is also. There are cards which you are dealt with, which are non modifiable risk factors. That is your age. The older you get, the higher the risk. The gender, if you are of male sex genetically, then you are at higher risk. But women, unfortunately, catch up after menopause. Then there is family history of heart disease. If your parents and your grandparents and your first degree uncles have premature heart disease, that is, heart disease below the age of 55 years for men and below the age of 65 for women, then you are automatically at a higher risk for heart disease. These are the cards that you've been dealt with. You cannot change them, but you can modify by adjusting by playing a different game. And that's the modifiable risk factors. The first thing is blood pressure, then cholesterol, lipid levels, smoking, obesity, lack of physical activity, diabetes, and stress. These seven factors are basically how you play your game of life. If you play a good game of life, then you can do whatever you want to do with the cards you've been given with. So remember, these factors, risk factors, does not mean you're destined for heart disease, but it is more of what can we do to adjust, or how can you change it. Remember, having these risk factors does not mean you're destined for heart disease. It just means you have to be more vigilant and proactive about your health. Now, let's move on to what are the signs or early signs that you have a blockage in the blood vessels of the heart. So, I'm going to divide this topic into people who are extremely active, people who are moderately active, and people who are extremely sedentary. So, let's start with the extremely active folks. These are the folks who are exercising, reaching their age appropriate target heart rate 5 to 6 times a week. For these folks, they already have inbuilt mechanisms and endurance where they can push themselves, and their mindset is also where they can push themselves, and they kind of have learned to ignore small signs and symptoms. They are more of the mind over matter people, and they are go, 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 and push, push, push. In those people, they might just notice they're struggling more. That is, if they run 10 miles a day, maybe in their fifth mile or sixth mile, they have to pause or they have to slow down, and they're taking longer to finish their 10 miles compared to what they did 2 or 3 weeks ago. Instead of saying or telling yourself, I'm just growing old, I just tweaked my knee and that's why I'm doing this, just think about it and say, this is consistently happening, and therefore something must be wrong, and I need to evaluate what is wrong, or I must investigate why I'm not able to keep up the same times I was able to do 2 or 3 months ago. So, for people who are extremely active, just look at your own metrics, and I'm sure you're following. I'm sure you have different wearable healthcare devices. Look at your metric and see why this is happening, and if you don't have a clear cut explanation, then you have to go to your doctor and figure out what it is going on. And chest pain, coronary artery disease, there are textbook symptoms, and we'll go about the textbook symptoms, but your body is not reading a textbook, and the symptoms can be anything. So keep that in mind. Change in your exercise capacity for an extremely active individual is a clear cut sign. Okay. Now let's move on to people who are not so or moderately active. That maybe you work out once or twice a week, or you just climb stairs, and then all of a sudden you're noticing when you climb stairs, you are breathing very heavily, or you have symptoms of chest discomfort. Please remember how I'm using the word discomfort and not necessarily pain. Discomfort can be a tightness, it can be a sharp pain, it can be a squeezing pain, it can be anything. But in general, the symptoms are below your nose, above your belly button. And remember, your arms are above your belly button and therefore falls under the category. I've had patients who complained of just this elbow pain, a left elbow pain, which comes on whenever they climb stairs, or they're carrying groceries up the stairs, or they are carrying a big bundle of clothes up a flight of stairs, and it goes away when they rest and relax and comes back again when they do anything physically exerting. Apart from chest discomfort, another common symptom is shortness of breath. And I'm not talking about like just a little shortness of breath, but I'm talking about huffing and puffing, like as if you've ran a marathon with just climbing a flight of stairs, or going from your house all the way to a parking lot or a Walmart parking lot, or walking more than a block. So again, when you notice these two symptoms, you have to truly think about something is going on with my body. And another useful way to think about it is, when was the last time you were able to climb a flight of stairs without huffing and puffing? And based on that, you can say, oh my God, I am progressively getting worse and I need to go to a doctor, talk about these symptoms. Okay, these would be for people who are not so active, just do day to day household work, but not measuring that they are in their 80 to 90% max age capacity. They're not like in an exercise program. So these are what you would look for, this subset of people. Now, coming on to people who are extremely sedentary, you're just working behind the desk throughout the day, you're not in an exercise program, and you don't do a whole lot. So when you do something, you notice, oh, I am getting short of breath. And you are thinking, I'm not exercising a whole lot, and therefore that's why I'm getting short of breath. So for these patients, this population, I shouldn't call you patients because you haven't been diagnosed with anything as yet, but for this group of people, if you notice minimal activities, day to day activities, activities of daily living, like getting up, going and taking a shower is wiping you out, doing your household chores is wiping you out. Discomfort, again, below the nose, above your belly button, including your arms, pain, which is radiating, jaw pain, neck pain, and just profound shortness of breath. You see people of your same age group doing those activities, and you are more wiped out, then something is going on, and that means you need to go and take action. Don't brush this off as that you're just getting old and you can just ignore that. And along with this, I have to incorporate yet another factor apart from physical activity level, whether you are a diabetic or not. If you have the diagnosis of diabetes, then your nerves are used to higher levels of sugar circulating in your body, and therefore you can have neuropathy, and therefore you may not perceive the symptoms of chest discomfort, that is anything below your nose, above your belly button, like a person who does not have diabetes. So all you may experience is just more fatigue, more shortness of breath, and inability to do your task without taking frequent breaks. If you're doing your laundry, then you have to sit down. Then you get up and fold your laundry, then you have to sit down. You get up and do something around the kitchen, and you have to sit down. That is not normal. You have to go talk to your doctor right away. It is not something you can ignore. So, diabetic patients are at a more disadvantage. They have already predisposed to blockages in the blood vessels, and they also don't feel symptoms like the non diabetic folks. So, this population has to be on high alert and have to constantly be in touch with, oh, how am I doing, and seek help as needed. So please, my dear friends who have diabetes, think about that you are at a higher risk and be on the watch out. In my opinion, having diabetes is like having a fire. It's always smoldering. The disease is always smoldering. Even if you are on a lot of medications and your hemoglobin A1C is at 6, the forest fire is still burning at the background, and the blockages to the blood vessels of the heart can happen. In general, we think of patients who have diabetes are already diagnosed or underdiagnosed with coronary artery disease and should be on all the medicines we give for patients who have blockages in the blood vessel. Let me share a patient story here. It was a regular work day in the cath lab. We had a situation called what we call as ST, elevation myocardial infarction, or a STEMI. It is basically a very abnormal EKG, which means a blood flow to one of the blood vessels is completely blocked. It's 100% blocked. All of a sudden, patients are extremely symptomatic to the point they cannot do their day to day. They can't do anything. They are, it's a stop, hard stop. You've called 911 or you've come to an emergency room with really profound symptoms of chest discomfort, sweating, can't take a full deep breath, impending sense of doom. Those would be those symptoms for an acute heart attack. And that patient came in, had this profound EKG changes. And we know from studies that these patients' blood vessels need to be opened within the 90 minutes of the time they came to the emergency room. So we are all in a go, 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 go. This patient happened to be just 42 years of age, was a male patient, was on the obese side of life, and the front wall blood vessel, which is also known as the left anterior descending artery, or the widowmaker, for the reason when you get a blockage in that blood vessel, patients die, and it's a widowmaker. We opened the blockage, and at that time you honestly have very minimal time to do a big chart review and go into details, but it was told to us that the patient was a diabetic at 42 years of age, and we opened up the blockage. Everything went well. So I finish the procedure and I go to talk to the patient, and I'm saying, hey, this is what happened. You had a clot blocking the front wall blood vessel. You put a stent. Everything is good now, but we need to do things. And the first question the patient asked me was, how did this happen to me? And why did this happen to me? I'm so young. And in my mind, I was like, yes, you are very young, but you are a diabetic patient. And when your blood sugars are not under control, the forest fire is raging. When the blood sugars are under control, the forest fire is smoldering. That's how I can visually perceive it. And I told him, your forest fire, your house is on fire, and I'm a plumber, and you've called me to urgently and emergently fix your plumbing, and I have fixed the plumbing, but I'm looking around in your house and your house is literally burning down. So you have to take control of the forest fire, which is your diabetes. And yes, you could put a lot of makeup and be on 5 different drugs to get your hemoglobin A1C. That is better than doing nothing, but you can also change the way you are eating so that you don't require a lot of drugs and try a more natural way of controlling your diabetes, controlling the forest fire so that the plumbing, the blood vessels to the heart does not get blocked. But this patient was clueless. And for me, that was honestly one of the motivations to do this podcast, for people to know when you are a diabetic, you are at a higher risk for heart disease. And it's not, oh, I have diabetes. It's not a big deal. It's not like that. When you have diabetes, it's a big, big deal. Even a cancer starts in a small organ and spreads to the other places of your body. But when you're a diabetic, every blood cell from your brain to your little toe is exposed to the higher levels of glucose and inflammation, and inflammation leads to higher triglyceride levels and higher LDL levels and higher blockages to the blood vessels of the heart. So please remember to, if you are a diabetic, or if you have a friend or a family member who is diabetic, that they have to be on extreme high alert about blockages to the blood vessels of the heart. Now, I want to move on to, when should you go to your doctor? When should you go to the emergency room? When should you call an emergency services such as like a 911 or whatever is available in your country? Let's just go with a normal, moderate activity, goes for a walk 2 or 3 times a week, does not measure anything, but just an average Joe, okay, who's not prioritized exercising or something, but who's busy with life, and life is stressful and hard at it as it is, okay? And you are climbing a flight of stairs, or you're running to catch a flight or catch a train or somewhere, and you get on your flight or get on your train, and you are huffing and puffing a lot, and you're wondering, man, when did this happen to me? I used to be able to make a flight or run across the airport without a problem. Why am I huffing and puffing? And maybe the time you're flying is a good time to introspect. When was the last time I was able to do this without any issues? And if the last time you were able to do that was a few months ago, okay, and you have noticed, oh, progressively I have gotten worse, and now I'm not able to, run if I want to, that's a good time to call your doctor, make an appointment in the next 2 to 3 weeks, and get a stress test and other tests which your doctor would think is appropriate, and go from there, okay? But if you are the same person and you are running around doing things around the house and you're huffing and puffing a lot, and you're like, what is going on? I'm not even able to do anything. And I was okay 2 or 3 weeks ago, but this is getting worse and worse and worse. And I'm not able to get up from my bedroom to the bathroom, and I have to sit in the bathroom or rest in the bathroom. Short, and the distance is getting shorter and the frequency is getting higher. That, my friend, is a time to go to the emergency room and get checked out immediately. So, if there is progression or acceleration of your symptoms of shortness of breath, chest discomfort below your belly, below your nose, above your belly button, including your arms, pain in your jaw, then it's time to go to the emergency room. Let's say you have symptoms at rest. You're watching a movie and you're feeling weird and you're feeling tight and you're beginning to sweat. You're not able to catch a full breath. You're getting the sensation of something is bad is going to happen. You have to call for emergency services. So please keep in mind that that impending sense of doom is your own natural survival instinct trying to tell you what you're feeling is life threatening. Therefore, you immediately have to call your emergency services. Now, the symptoms I'm giving, I'm not a textbook right now, so I'm not being completely exhaustive of your symptoms. So please bear in mind, if you feel something is not right with your body, it is time for you to get up and go and ask for services. Now, you could also be like, hey, one of the most common symptoms patients have and they ignore all the time is indigestion. Okay, I have this heartburn, and it's heartburn, and it's not It's not related to my heart. It's just indigestion. I'm going to take Tums. I'm going to take Gelusil. I'm going to take Gas X. I'm going to take whatever over the counter, and that might be it. I cannot tell you the number of people who have indigestion, who have diagnosed themselves with esophageal spasms, which also comes lies inside your chest and can cause very similar symptoms, and ignore their heart health. So in the chest, there's just not your heart. There is your lungs, and there's also your food pipe, okay, which is your esophagus. And your stomach and esophagus, the food pipe and the stomach kind of join at the lower part of your chest. So if you have reflux disease and acid reflux, that's going to cause a burning sensation in your chest, which can also mimic a heart attack. Why is that? All these organs have the same nerve supply. And since they have the nerve supply, you can get referred pain from one organ to another, and it can be very confusing. So patients often ask, how do you distinguish these different symptoms? Okay. And this is something I tell all my patients, and here I am telling you as well. The heart is a drama queen. It's a total diva. If something is wrong with it, it is going to demand you to take more action. You cannot ignore the symptoms and walk it off or burp it off or do something. If if you are doing that, it's going to keep coming on and on and on. Okay, so the heart is a drama queen. It requires you to take action. And you can even check your timeline. How frequently are you taking action? Are you swallowing more Tums now than 2 weeks ago? That's a sign. You cannot ignore it. Are you burping more frequently than before? That is a sign. I cannot tell you the number of times I'm in the blood vessel, especially the right coronary artery. Can cause a lot of GI related issues, and it's a great mimicker. I'm inside the blood vessel, I'm blowing up a balloon or putting up a stent inside, and the patient's like, I'm having the same chest burn or the heart burn. And it's just a different variant of it. So if you are having these symptoms more frequently, and it's happening for a prolonged several weeks and it's not getting better, it is something you have to seek action. Okay. And another thing, a very simple test you can do. You think it is heartburn, or you believe it's acid reflux, and you are completely convinced of it. Try and do a physical activity. Try and climb a flight of stairs. Does that heartburn get worse? Is it being associated with difficulty breathing? Are you beginning to feel a little cold and clammy? Those are signs that you have to stop right then and there and go to the emergency room or call your emergency services, or even talk to your doctor. Pick up, if you have a friend who's a doctor, pick up that person, pick up the phone and say, hey, what do you think? Just don't ignore it. That is the point I'm trying to make. Okay. And when in doubt, it is better to get it checked, and then instead ignore it or sleep it off. And because your body will be tired, and when you are in a state of rest, you are protecting your heart, but you might be sleeping through a heart attack. One of the biggest population, I also work in the veterans hospital. My veterans, they are so stoic, and they have been trained to ignore pain and work through pain and exercise through pain. And those are the patients who come to us when they can no longer function, and they've suffered a massive heart attack, and their heart function has gone from a normal of more than 55% to 20% or 30%. And then we are basically playing catch up, and we're trying to salvage the muscle instead of saving the muscle from a heart attack. So what happens when the blood vessel is completely blocked and you suffer a heart attack? Heart is a alive, healthy, living tissue. When it immediately acutely gets lack of blood supply, it's going to release different enzymes, and different tissue, basically your tissue is dying. So if we catch it within the 90 to 120 minutes, depending on where you are, we can pretty much, you may end up with a small teeny tiny heart attack, and the rest of the muscle recovers. So time is muscle. which is more important than time is money theory. So time is muscle. So don't ignore your symptoms if it happens. So it's just not a clot which can cause a heart attack. If you have progressive narrowing of blood vessels and then you ignore it and you keep pushing yourself, that can also cause a different type of heart attack called a non-STEMI, which is not an acute ST elevation MI, but a non-ST elevation myocardial infarction. It's a different type. And then another type is just unstable angina. Angina just means chest discomfort, and unstable angina means you haven't had a heart attack, but your blood vessel is on the plaque is unstable and you're at kind of threatening to have a heart attack. Those are the patients who have accelerating symptoms. And that's why if you feel like your symptoms are getting worse from last week to this week, it's just progressing, once again, time to go and talk to your healthcare provider. Now, I've told you about the signs and symptoms of heart disease. Depending on how you project yourself to the hospital, the treatment can vary. Okay, if it is a ST elevation MI, when you come in, the moment your the firefighter or your EMS or your ER provider sees those ST elevation, they pull a trigger, and that's what happens when I'm on call. I get a call, someone's having a heart attack. I drop everything what I'm doing, and I go to the hospital. The entire cath lab team drops whatever they're doing and comes to the hospital. And within 90 minutes, we go through the artery in your arm or in your blood vessel in your leg, pass a wire, pass a catheter, aspirate clot if we have to, and then put a stent in. And sometimes, the heart, we can make out the ST elevations are not coming down, and we may have to put some mechanical circulatory support that is external machines to kind of help and rest your heart, and we could also do that. But if you're successful in aspirating the clot and putting a stent in, the ST elevations, which are changes in your ECG, resolve, and it's one of the most gratifying things, points of being an interventional cardiologist. Patients will come extremely uncomfortable. They'll be writhing and they'll be sweating and they'll be like moaning in pain. And moment we restore blood flow in the blood vessel, the ECG gets better, the heart rate comes down. They literally, the sedation medicines which were not working because they were in pain starts working, and they actually start sleeping in the bed, and we know they are doing better. So that's the ST elevation MI. For the other kind of not emergent but still urgent situation, you come to the heart. We start you on a blood thinner called heparin. We measure enzymes called troponin serially, and depending on how big the troponin and the creatine kinase MB fraction is going up, we can kind of quantify how big is your heart attack, and that determines the timing you go to the cath lab, and we see how bad the blockage is, put stents in. And sometimes you may have very calcified disease, and we may have to clean out the blood vessels during different tools, and then eventually put a stent in. And those are the times we may even find blockages, not in one blood vessel, but all three blood vessel, or sometimes in the main blood vessel. And we will finish taking the pictures, then kind of have a collaborative meeting with our cardiac surgeon partners. We call it a heart team approach, and figure out which is the best way to treat you. It may be open heart surgery, where they take veins from your legs or use the blood vessels running on either side of your breastbone and bypass the blockages. Or if your underlying risk is too high because you're a smoker, or you have very bad lung disease, or you're extremely depending on the frailty or other factors, we may say stents are maybe the best option, and you come back to the cath lab and you may get stents. And this is how the treatment for the blockages problem goes. I want to make one statement very, very clear here. Stents fix the problem of blockages in the blood vessels of your heart. It does not cure coronary artery disease. Coronary artery disease is a progressive disease which has to be treated with stents in some situations, but with also with medications such as beta blockers, statins, cholesterol medication, ACE inhibitors to reduce the blood pressure or which helps with the remodeling of your heart, and aspirin and Plavix or clopidogrel, prasugrel, ticagrelor. Or these are all different blood thinners we will put after you've had a heart attack, depending on your risk factors. So these are extremely personalized and based on the amount of heart attack you've had, the amount of ejection fraction or the functional capacity of your heart, and your other risk factors, bleeding, etc. We will come up with your medication regimen. So once again, stents does not cure coronary artery disease, but it fixes the problem of blockages, which causes chest pain and shortness of breath and things like that. The stents have come a long way. We used to have non-medicated and medicated stents, but the non-medicated stents have pretty much gone away. We only use medicated stents. They're ultra thin, and what these stents do is the blood vessel is an elastic structure. Okay, so like an elastic structure, it has recoil. So if you just balloon the blood vessel, over time the elastic recoil could kick in and it can narrow and collapse. The stent is basically, think of a chicken coop wire, just folded in different angles, keeps the blood vessel stented open and stays there. Now, people have asked me, why can't you just do preventive stents? Why can't you just put stents in all blood, any 20, 30% blockages? Why are you waiting for symptoms to happen before putting stents? So the reason why we don't do preventive stents as of yet is the technology is not perfect. It is an invasive procedure. Anytime we put wires and catheters into the human body, we are going through the highway, which is the blood vessels, and the highway could have plaque buildup, and the wires could flick off a plaque anywhere, and it can cause a stroke. It can even cause a heart attack. And the catheters, we engage the catheters into the blood vessel, and sometimes the catheter can cause a tear or a dissection of the blood vessel, which can have catastrophic complications. We go through the wrist or we go through the groin, and sometimes you can have bleeding complications through the blood vessels you go through too. So, even though the overall risk of complication of a heart catheterization is less than 1%, there is still a chance that you can have these complications. And that's why we don't want to take a person who has no symptoms of heart disease and put stents in them. We wouldn't, if you have elevated calcium score or a high plaque burden, we may put you on medications. But if you are asymptomatic, we don't want to put stents in you, because all the long-term data has suggested that putting preventive stents does not have any quality of life or quantity of life benefit for the patient. So there are a lot of patients, there are a lot of practices. Patient is absolutely normal, like, they are exercising really well, they have no symptoms, they have nothing, they have a full life, and they will go get a calcium cardiac CTA, which shows severe blockages, and they're like, what do you do with this? I have severe blockages. I've been told that I'm at a very high risk for having a heart attack. What do you do with that? And all I want to say is, when you have an elevated calcium score or you have a lot of plaque burden, that is like looking in the mirror of an elderly person who has a lot of wrinkles. Just because they have a lot of wrinkles, that does not mean they're going to die pretty soon. It's just an external manifestation. You need a functional test. We need to put you on the treadmill and see what your exercise capacity is. And if your exercise capacity is great, and or if you don't have a large area of your heart muscle greater than 10% at risk or not getting adequate blood supply, then you are truly better off being managed with medications. My daytime job is an interventional cardiologist. I make my money by stents I put in. And I am telling you, not all of these need stents. Okay. So because it is an invasive procedure, it's not a Botox injection, it's not a prostate exam, it's not a mammogram where there is no downside. Okay, so these invasive procedures have to be thought out, and you have to balance the risk of doing a procedure against the benefit of doing a procedure. So be careful about people who are just doing tests but don't know how to interpret the test adequately. All right. So now I want to shift the gear to prevention. Prevention is truly the heart's best friend. So let's keep your heart happy and healthy by preventing this. You don't want to see an interventional cardiologist. I promise you. Diet. Diet is your fuel, and you are what, depending on the quality of fuel you put, is what your health is. I have done so many podcasts, all my podcasts about obesity, diabetes, fatty liver, obstructive sleep apnea, smoking. It all culminates to this thing. Lifestyle is the best way to manage your longevity. Okay, so don't eat ultra processed foods. Go for all natural foods. I'm not going to get into low carb versus high carb. It depends on your risk. I have a very strong family history of diabetes. I have to manage my carbs. I also have a chocolate addiction. I have to manage my carb intake. So, therefore, a low carb diet is much better for me. And let's talk about a ketogenic diet. There's a very, very healthy way to do ketogenic diet. A lot of my neurology friends who specialize in epilepsy and seizure disorder prescribe ketogenic diet to their patients, and that's a very healthy ketogenic diet. It does not mean you're eating lots of butter and bacon, but instead you are basically just avoiding ultra processed food, and your diet is fresh produce and fresh meats, and that's about it. Let's talk about red meat. Anything which is not in moderation is not good for you. If you are going to eat red meat 3 times a day, all 7 days of a week, and you are not eating adequate fiber, it's not going to be good for you. So, honestly, common sense is good. Okay. I'm not saying never eat that candy or sugary treats, etc. Those are treats. Just moderate them and do your own experimentation to see what works for you. Now, let's move on to exercise. If there is one thing which has been proven beyond any other procedure, beyond any other medical intervention, it's exercise. The more you exercise, the better you live. The more, in the sense, I'm not talking about number of hours of exercise, but I'm again common sense, moderation, 150 minutes of physical activity, which puts you at a moderate intensity exercise. It can be, pick your poison. It can be walking, fast paced walking. It can be swimming. It can be cycling. Combine it with strength training, balance, and mobility. Find something that you love. Make it social. Find a friend. Do it as a group. In my MBA group, we have 2 or 3 different healthcare groups. We have different funky names, but definitely, but we are all working together to just to be motivating each other. And if we see a friend who hasn't posted about their exercise in a couple of days, we call out on them. We are gently encouraging people and motivating our friends to embrace a healthy lifestyle. So exercise is extremely important for a good quality of life. Money does not buy you happiness, but exercise can actually bring you happiness. So think of exercise as the most important pivotal portion of your life. Like how you would not go out without brushing your teeth or showering or getting ready, wearing good clothes. You should not end your day without 30 to 45 minutes of exercise. That's how important exercise is. Now, let's move on to stress management. You can eat the healthiest diet, exercise the best way possible, but you are stressed out chronically. And because of your stress, you're not getting adequate sleep. None of that matters. You have to manage your stress. And and as I tell my children, you can't control the world around you. I tell myself this also. You cannot control the people around you. You cannot control the deadlines around you, but you can control the way you process the stress around you. So listen to the podcast with Dr. Jonathan Fisher. He talks about how he was running a while, and I talk about how I almost lost it, and how we all had to reel it in and use whatever works for us. There are different ways. I mean, if you're a yoga person, go into the religious mode, chanting. If you do what appeals to you. I don't like religious connotation. So mindfulness appeals to me and I go the mindfulness route. So do what speaks to you. And then finally, regular health checkups. Stay on top of it. If you are a diabetic, you better be seeing your primary care provider every 3 to 6 months. If you have known history of heart disease, you better be seeing your doctor once or twice a year. If you have a very strong family history of heart disease, at the age of 35, you better be seeing your primary care provider and getting your cholesterol checked. And thereafter, once a year, you should be getting your lipids and everything checked. Did you check your lipoprotein lipid? Oh, that's a big, big factor. Let me talk briefly about lipoprotein lipid. It's lipoprotein little a, just basically a small a in parenthesis, is basically determines what are the cards which has been dealt to you. If it is elevated, then you have a strong inherited risk of coronary artery disease. Right now, PCSK9 inhibitors, Repatha, etc., are the injectable forms, can reduce that number by 20 to 30%. There are a couple other drugs which are in phase 3 trials. They are not in the market as yet. But if you have an elevated lipoprotein little a, then you better be super aggressive about diet, exercise, and stress management, quit your smoking, etc. Same way, coronary calcium score. If you have a high family risk and you do a coronary calcium score and that is high, you need to modify the other risk factors very aggressively. That's what that means. Okay. And now I want to end with a call to action. Please practice mindfulness. Okay. Mindfulness is just not sitting in a dark room and meditating. Mindfulness is eating mindfully, drinking mindfully, making a decision to quit smoking, and making a decision to exercise on a regular basis. So, mindfulness is a lot. It's just not meditation or chanting or whatever. And then remember, chance favors the prepared mind and the prepared body. Even if you have terrible cards, you have a strong family history of heart disease, you have a strong family history of diabetes, and you're like, oh, I'm destined to have heart disease. But if you are exercising and modifying your risk factors, maybe your parents had to have bypass surgery at the age of 40, but you could just walk away with a one stent. And that too, you can know that this is happening to you and you can go to your doctor. Your doctor can do a stress test, figure out, okay, there's a large area at risk right now, and do an elective procedure, compared to you ignoring all of it, calling 911 and having a dramatic ST elevation MI kind of a situation. So again, you can't control the cards that you've been played, but you can control the game. That's on you. And so lately, lastly, if you have not seen a doctor, you are about the age of 35 and you're in the 40s and you haven't seen your doctor, and you honestly don't know what your risk factors are, and you have not actually talked about it, please make an appointment with your healthcare provider. We are all here. And right now, at least in the United States, the healthcare system is progressed and regressed. Progressed in the sense we have a lot of virtual care providers and you can meet them virtually even if they can't see you, but just talking to them can give you a rough estimate. It's regressed in the sense that if you call for an appointment, it is 2 or 3 months down the road. But if you are asymptomatic and the first appointment you get is 3 months down the lane, make that appointment and go there and see what you can do and what you can change. Remember, at any age, you have the power to reboot your health, reclaim your life. Your heart works tirelessly for you 24/7. All it deserves is a little bit of attention, a little bit of care from you. Thank you for tuning into this episode of Reboot with Dr. Arasi Maran. Until next time, keep your hearts healthy and your spirits high. Thank you so much for listening. If you found us valuable, you can subscribe to the show on Apple Podcasts, Spotify, or any of your favorite podcast app. And also, please consider leaving us a rating or a review, as that helps others find the podcast too. I hope you have a great week ahead.